you're gonna feel like you're drowning, and sometimes you're gonna feel like you wanna die before they do.
It's a gift, but it can be very painful at times.
That constant stretch of which way do you go? How do you meet the needs of your children, raising your children, and the needs of your aging parents?
So you end up feeling depressed and hopeless and helpless and like the sky is going to fall.
More than 34 million Americans are caring for a friend or family member over the age of 50. Unpaid, informal caregivers have long been the nation's safety net in taking care of our elders. But they're being asked to do more than ever before, and with little support. Half are trying to hold down full-time jobs. Many also are raising children. They are doing the work once done by doctors and nurses in hospitals, and many are doing it for years at a time.
When Medicare passed in 1965, the average age at death was 67. The average cause of death was relatively abrupt. It was an infection or a heart attack or a stroke. And we've never retooled the system to deal with slow decline.
I mean, we have people doing ventilator care, intravenous therapy, very complicated wound care. This is an army, an invisible workforce that needs to be helped.
We are going to double the number of frail elderly between 2000 and 2035. We're excited that there are all these boomers going into Social Security. Trivial. What really counts is when they start getting disabled in about 20 years.
The stress on the medical system and family finances at that time could be substantial. Medicare, the government's health insurance for those 65 and older, doesn't pay for assisted living or nursing homes, much less services to help with such things as cooking, shopping, or bathing. Families now spend an average of $7,000 out of their pockets each year to cover those costs, according to the AARP. Long-distance caregivers spend nearly $12,000.
You end up investing money that you may or may not have in trying to get help for the person that you love.
We have an unprecedented 10,000 baby boomers reaching retirement age every single day, and their stagnant incomes are really no match for the longer lifespans, for treating chronic medical conditions, and for addressing long-term care needs.
Families figure out ways to cope. Jack Myrtle, who will soon turn 96, lived on his own in an apartment at Alexian Village, a retirement community in Milwaukee. His wife died 8 years ago. Last month, his children agreed it was time to move him into an assisted living wing in the same complex.
Been always a very independent guy, but somehow or other, what the kids want
Happens.
happens.
We tag team. And the biggest thing to me is that somebody's checking on you at night to make sure you're in bed safely and that you're cared for, and to check on you during the night. Those are the big things, and to all my siblings, we feel that way.
For Soraya Corzo, she decided to have her mother, Gloria, move in. Gloria has mild cognitive impairment and takes part in activities at a Hispanic-focused senior center in South Milwaukee.
These are our parents, and when they took care of us, now that they're older, we have to be there.
With family sizes shrinking along with a labor pool of available and qualified elder care workers, fewer caregivers will be available as baby boomers hit their later years.
Right now, about 7 potential family caregivers for every 80-ish person who's at highest risk of long-term care. And, by 2030, that's going to be 4 to 1.
This is a critical moment for us to rethink and redesign how we care for our families.
And this is a calamity we can see. We could be all ready for it.
We really are at a crisis point because of the aging population, aging caregivers, as well as aging care recipients.